and welcome to Israel Healthcare Highlights, where we share important information and inspiring stories from Israeli healthcare with English language audiences around the world. I'm Bruce Rosen from the Hebrew University in Jerusalem. My special guest today is Sefi Mendlevic, the Associate Director General of the Ministry of Health. Sefi, welcome.
Hi, good afternoon, Bruce.
So our main topic today is about the physician shortage. Sefi, who is the number 2 professional within the Ministry of Health and the highest ranking physician, has broad policy responsibility for this topic, and we're going to go into it in some depth. But before that, Sefi, I'd appreciate if you could tell our viewers a bit about yourself and your background, and please speak a little bit more loudly and more clearly.
Okay, so hi. So I'm 47 years old. I live in Jerusalem. I have 5 kids. I'm an emergency medicine pediatrician. I still work as a physician. I used to be the chief medical officer of Shaare Zedek in Yerushalayim, and for the last 3 years, I'm in this position. It's very challenging, especially since the war, since October 7th, because as you all know, we have to deal with this very problematic issue. But my hobby, as I would say, among all my responsibilities, is actually dealing with the reforms with physicians. So the shortage of physicians that we'll speak about today, it's the core, it's the main reason of the need of all these reforms.
That's great. That's great. So now tell us a little bit about the shortage, where it came from, how bad is it? And then after that, I'll ask you some questions about how the ministry and others are dealing with it. But first, the problem.
So the problem, in order to elaborate, we have to first go to the past. And the past, as you all know, Israel is built upon immigrants. So in 48, when Israel was established, the physicians were all of them were new immigrants, and in the beginning we only had like about 2 medical schools with very small classes, and we were and it was a very young country without a lot of medical needs. As we were about to face a shortage of physicians in the late 80s or early 90s or mid 90s, we had the miracle of the Aliyah, the great immigration from a former Soviet Union, which had a huge proportion of physicians. So it was like a bandage of a more profound problem that Israel has never dealt with in order to prepare as much physician as she needed. And during the time, the number of medical students in Israel was very low, about 400 physicians. Let's take me. I graduated. I started medical school in 2001, graduated in 2007, and in my classes in Beersheba were only 70 medical students. I'm mentioning this number because we'll come back to it later. Now, what have happened during the time? First of all, there was a great need for physicians, and also socially, a lot of people want to become physician. And as many people know, it's very hard to be accepted to the medical school in Israel. It's unbelievable. The grades are unbelievable. So a lot of people, and not because it's a rocket science, because just the demand and it was a very low places to study medicine. So during the last years, I would say about 10, 15 years, but especially in the last 8 years, a lot of people went abroad to study medicine. Some of them in the beginning in the very good places in, for example, Hungary. I'm not talking about, United States and England and Canada, of course, but also Hungary and Czechs and a lot of places, and also some places in Italy, a lot of other places. But in addition to this, as year passed, people went to very problematic medical schools, especially in the former Soviet Union, like in Armenia, like in Moldova. And what happened, and this is the source of the issue. About 8 years ago, Professor Shaul, who was also from the Hebrew University, He came to the Ministry of Health, and what he did, he's a very distinguished professor, and he went abroad to all these places, and he did accreditation. He went to these medical schools, and with a certain criteria, he said, you are good, you are bad. And the places who were bad were disqualified. And the Ministry of Health passed a law in 2019 or in 18, and he said, all the people who will start after the year 2019 in these certain places will be disqualified for becoming physician in Israel. And if we're going to this, so this is the history. Now let's go to the statistics. It's unbelievable, but Israel has the very problematic record of, in the OECD, the country with the highest physicians who were trained abroad. About almost 70% of the physicians who got licensed last year didn't study in Israel, which is unbelievable. About half of them in good places, qualified places, and about half of them, which is 35% from the total of the licensed physician, went to a disqualified places. Now, 1 year and a half from now, take 2019, take 7 years ahead, we'll finish licensing these physicians.
So those who already started are grandfathered in, but these schools can't be a source for new physicians. Now, if I understand you correctly, there's two issues. There's two problems. One is that many of the large number of physicians who came in the massive aliyah of the late 80s are now starting to retire or have started to retire. So, and the medical schools in Israel didn't grow enough to replace them. And in addition, many of the people, an important source of physicians was people studying in less good medical schools in Eastern Europe. Do I have that correct?
Correct. Now, in addition to this, Israel is the fast growing population in the Western world, about 2%. In addition to this, the aging population is the fast growing in Israel, people about 70 and 75. So it's like a tsunami. Okay, we have a severe reduce in the number of incoming physicians, increase in the population in the aging population, and it will be a clash in 2026, 27. Fortunately, in the last 2-3 years, we did a lot of things which will help us to cope with these problems, but it will take time.
Well, that's great for the first part of our session. I think you've really laid out the problem very well. I know it's a topic that people can go on about for hours, but I think within our short time available to us, the problem in its main parts is quite clear. Now let's move on to part two. What's being done about it?
So what's being done, I have to refer to another one small issue because to tell what is being done. There is a severe difference between the center of Israel and the periphery, because you cannot take Israel as a whole, and you cannot say it's a problem of Israel, we have a shortage of 1,000 physicians. No, because in the center of Israel, we almost won't see a problem, okay? But in the periphery, both in the north and in the south, this is where the highest number, unproportional number of these physicians. For example,
these physicians being those who studied
disqualified.
Well, the physicians aren't disqualified. The physicians who studied in institutions which will no longer be qualified.
Yeah. So I'm not now throwing names, but you go almost to all the hospitals in the periphery, more than 60 to 70% of their residents are coming from these disqualified universities. Wow. So it's a social problem. It's not like a problem of number. And I think it's a great illustration of the severe differences between the center and the periphery. Now, what is being done? So in order to do this, you have to ascertain this problem in certain issues. First, to see the whole number, but also to be focused on the periphery. So this is the two main vectors. Regarding the whole number, what we've done in the last 3 years, we raised, and we're going to raise even more dramatically, the number of medical students. So if this
in Israeli institutions.
Yeah. So if about 6 years ago the beginners of medical school were about 800 medical students. This year, we've started medical schools in 1,254
Wow.
medical students.
Wow,
Okay,
that's an increase of over 50% in just a short time. That's amazing.
yeah, but we are taking it more. Uh, we have a very I would say inspiring goal in 2027 to start um, teaching 1,700, 1,700 medical
Wow.
students. So it's
Wow.
double the number in a few years, and
Wow.
until 2030, 2,000 students.
Wow.
And in order to do this, it wasn't just numbers on paper. We did a very unique collaboration with the deans, with universities. And so, for example, if I studied with another 70 colleagues in medical school, now in Beersheba, they're going to start 150, and in 3 4 years, hopefully 200 students.
Now,
Okay,
is the Israel Medical Association also involved in this in some way?
so the IMA is not involved with the students because
No.
it doesn't have any connection to students. Where the IMA is involved, so this is one reform. It's a very big reform, but it wasn't only just to fix the numbers. It was how to distribute the medical students, to distribute the clinical fields, which also are very problematic, in order to do this reform. Another very important reform.
Wait, I just want to say it's not just the it must have taken a lot of money, and you and your colleagues
Yeah,
must have had to work with the policymakers to make them understand this is a priority and to encourage, money's not growing on trees in Israel these days. And you must
yeah,
have been very
yeah,
effective in clarifying for them that this was really important to the state of Israel.
yeah. Thank you, Bruce. Yes, it was very hard work. So this is one thing. The other very important reform, and there are many, I will assert only certain one, is only for the first time we are start to do a very thorough planning of doctors in Israel. Not only the whole number, but the distribution between the different professions, both the professions also geographically.
By
So
professions, you mean the medical specialties
yeah,
such
so
as
we
general
need a certain
surgery.
number of oncologists nationally and regarding the different geographical area. It's unbelievable, and it haven't been done until lately. So I'm coining with the Director General this very important committee, which is distributing or setting the goals of the number of physicians for 2035. Because if
Wow.
you want oncologists in 2035, you have to start working now, 10 years earlier. Okay, so this is another thing. The third thing we are doing is we're doing many things, but I will certain only three issues. Is specific programs for the periphery, which is very important to say. Okay, and what we are doing, because physicians. So first of all, we've opened universities in the periphery, okay, in the northern part, hoping that it will last and the medical students will stay in the periphery. But unfortunately, we see that once they're finishing the medical school, they're coming back. Also in Beersheba, I'm a failure. I studied in Beersheba, but the moment I finished medical school, I came back to the center of Israel or to Jerusalem. Now, what we're doing now, we started an amazing project. It's called Ilanot. We are taking each year 40 students from the north and 40 from the south, and which are the residents of the south or the north, knowing this is the highest chance that they will stay next to their families, their parents, their siblings, and they are going into scholarship, uh, teaching leadership, and they will be the next leadership of these places. We're doing another program. It's called Ofakim. It's called the Norwegian model. So we're taking people from qualified medical schools in Europe, like Hungary, and we're giving scholarship for the whole medical school. It's for very good students who just didn't make it to the Israeli medical schools, and telling them you'll have like a scholarship if you come back to the periphery or to certain professions. And also, it's supposed to be a very success, and also giving very unique scholarship to people who are coming to the periphery. So this is just a tiny of the things we're doing.
This is great. This is just what I was looking for. We only have a few minutes left. So I'd like you to ask you to do two things. First, please come back to the issue of the Israel Medical Association. Are they involved? How are they involved? And then second, after that, if you could just give us a few takeaway messages. Thank you.
Okay, regarding the IMA, of course, we are working with the IMA. As always, government and unions. Sometimes we're doing things together. Sometimes we are objecting one another. It's fine. For example, our aspiration to do a very specific planning of the physician. This is something that the IMA doesn't like, but we are sitting together in this committee I mentioned. This is one thing. IMA, he is responsible together with the government to a certain different medical professions as professions which are in severe shortage, and by the agreements with the government, we are giving them a bigger salary or scholarship. So this is a very important position of the IMA. This is one example. The IMA is a very strong and important player, in this field. In addition, we're doing also certain thing with the scientific council regarding the establishment and the managing of the residency in Israel, but this is a different ball game.
Okay, that's good. That's what I was looking for. So now we only have about a minute left. How would you summarize what should we take away from this? Remember, our audience here is primarily English speakers outside of Israel, many of whom are healthcare professionals, some of whom might not be. From this topic, what have we maybe learned about Israeli healthcare and the Ministry of Health?
Okay, so first of all, I believe that Israel has very unique and great medical system. I really believe in it. This is the reason I'm working and I'm doing what I'm doing. And we have the best physicians. And the take home message that we figure out there is a problem, and because of the basics of this system are very good, the different players, the very centralized managing. Because of this infrastructure, we are managing to do these major changes in a very short time that in other places will take 30 years. So I think it's really a very good example of Israel. Okay, there are problems, but on the other side, we are very agile. We know how to accommodate to problems and to give a very fast solutions. And I hope we'll see them in the next years.
Terrific. Sefi, that was excellent. Thank you so much for joining us.